Good morning, everybody. Who's going in for surgery this week? I am. I'm going in for surgery. Not really happy about it, but this is part of life and getting older. We need to have surgery for a variety of things. But when you hit 50, you get to go into the colonoscopy club. Um, I am past 50. I'm having something else done, but I wanted to share with you, especially since this isn't the first time I'm having surgery done. What you need to think about before you go into the surgery room to put your mind at ease, put your family's mind at ease, and what I've kind of been doing to get ready. And hopefully this information is helpful to you and maybe makes you more prepared and less anxious before you go in for surgery. So first things first, before you go in to meet with the person that's possibly going to do the surgery, I recommend going in and doing a little bit of research. Talk to the doctor that's referring you and also do some research at different medical websites, not a regular Google search. Go to medical websites like WebMD and ask about the surgery that you are having to undergo and see if there are options within the surgery room for how they might perform the surgery. Some surgeries use heat, some use cold, some cut, some use radiation. There's a bunch of different things that you could be undergoing. And some surgeries are more aggressive than others and have more drawbacks. For example, sometimes when women undergo a hysterectomy, one of the things that they will warn you about is there is a possibility that you'll have bladder issues after that. You would want to know that before you go in. Some doctors will actually have you sign a waiver. I advise you to read the waiver really carefully because it lists possible side effects and things that could happen after surgery. Most of the times, if you are having surgery below the waist, one of the things they're going to warn you about is blood either in the urine or the stool, depending on where the surgical team is going. So get all of the information that you can about the different options before you meet your surgeon. Then do some research on your surgeon. How long have they been doing this? Where did they get their education? Read the reviews. Are the reviews saying that this surgeon was excellent and had a great bedside manner and his office followed up? Or are you reading reviews where they say, I think he was too aggressive. I think he or she took more than they needed to, or they didn't take enough. So again, different type of surgeries. If you're having a cancer tumor removed, right, you want to talk to them about all the options and what the goal is. Always know, before you go into surgery, you should know what the goal is. Now, I'm not a doctor. If you read the disclaimer on my website, I am trained to be an attorney and I have training to be a life coach. But this is just basic, I hope, common sense. But I've talked to people and they've gone in and not done any research. No research on the procedure that's being done to them, no research on the person that's doing it. And if you're not comfortable with who is going to be operating on you while you're under anesthesia, that's a problem. I would ask your insurance to find another doctor for you. You have to have complete 100% trust in the person performing the surgery. And I would be looking for great reviews, if you can, ask family members, who did you go to? Who's your person? I know a lot of people that have had knee replacement, hip replacement, and even shoulder surgery. Pretty common knowledge in my community who the best person and persons are to go to and what groups people stay away from. So get those referrals from family members too, and then meet with those surgeons. Unfortunately, you're going to have to deal with health insurance. The first person that was on my list, my insurance no longer is taken by that doctor. So unfortunately, I went to the next person, also great doctor, just maybe not as well known in the community because he hasn't been here as long, but has done enough of these surgeries that I feel comfortable with him performing the surgery and cutting into me while I'm asleep. Other things, pre-surgery, you're going to get a call from the hospital and they're going to ask you all these questions. So be prepared for that phone call during the week where they say, okay, what medications do you take? And if you don't have a list with the milligrams or grams that you're taking, you're probably going to have to call them back because they want to know everything, including your supplements. So I take calcium with vitamin D3, and even that was considered to be something that, hey, you probably want to hold off on that for, this length of time before your surgery. Or if you're taking any blood thinners, most blood thinners, you have to stop a week before surgery because of the bleeding risk. Some anesthesiologists will say, this particular medicine has an interaction with the anesthesia, and so you're not going to take it 24 hours before the surgery. Most people realize, hey, you know what? You don't eat or drink midnight before the surgery. And so those types of questions that they're asking you in terms of your medications and the supplements, they fall in that same range. They're also going to ask you about prior medical history. Have you ever been under anesthesia before? What types of surgeries have you had? Unfortunately, I've been in a couple of car accidents, so I have had to go under anesthesia before. I know that in the past, I haven't had any kind of bad experience from it. And so that usually gives people, that are anesthesiologists a greater level of comfort that you've been under before, you didn't have an adverse reaction, you're not allergic to some of the stuff that we might use, and you're good. They're also going to ask you, though, about certain conditions. So they're worried about your heart. They're worried about your lungs. They're going to be looking to see if you're diabetic. Anything that could possibly put an added risk on the surgery. And I will tell you this, I have had family members and close personal friends that have foregone surgery because of certain medical issues that they had, and they felt that it was a greater risk to do the surgery than it was to not do the surgery. And that's something that you need to talk to your doctors about and figure out. No one wants to do all that surgery prep, go in the day of surgery, and then you change your mind, or that's a problem. You don't want to do that. So really think about your options, think about, your current health condition, and have a good support team. So that's the other thing that I was very careful about. I have a support team of people that know I'm going in for surgery. They will be before, during, and after surgery there for support. They know what to do if they go into surgery and there's a surprise. What do? Do you close me up and just do what you were told, or can you go further? I also have things like a power of attorney. I have my will in place, again, just in case something crazy happens. And, you don't always know when your, time is up, and that is always a risk. You hear about people that go in for plastic surgery and there's some sort of complication and they end up in the hospital, or they never come out of surgery if there's some sort of complication. So my will is in place. My beneficiaries are updated. I can go in to surgery and know I don't need to worry about something happening to me, and then my family kind of, struggling and being frantic and trying to find documents. They know where all the legal documents are and everything's up to date. So I've been on and talking for a little bit. I don't see any questions popping up in the comment field. When I do live streams like this, I do try to stay on for a certain amount of time to give people the opportunity to see, hey, she's live, she's giving out free advice today. Again, not a doctor, it's not medical advice. I'm just telling you, this is all my personal experience, the experience of friends and family members, and then also just the fact that I'm old. I'm older than I look. Drop in the comments how old you think I am. I feel like I'm 100 some days, and other days I feel like I'm 18. So, but when you are going in for surgery, it is something that you need to take seriously. I hope some of the tips I've given you help. I think it's better to be over-prepared than under-prepared. I know some people, they just try to put the surgery thing out of their mind and try not to think about anything until they're actually going into the operating room. If that's how you want to deal with it, I can understand that. That's one way to deal with it. I just know that I would rather have all my ducks in a row, ask lots of questions on the front end, know what the expectations are. My doctor's awesome. His office gave me a folder. It has a map of the hospital that I'm going to and where I need to go in. It has a list of pre-op and post-op things I need to know. They've already called in prescriptions I'm going to need after surgery. So You want to go in and you want to feel confident. And, if it's a couple of days before surgery and no one has reached out to you to kind of tell you what to do, where to go, what you're supposed to be doing, reach out to them. Office personnel are not 100% foolproof. Sometimes there are mistakes that are made. They might have tried to call you and there was a missed call or a number was written down wrong. Call them and ask them, what am I supposed to do to get ready? I'm scheduled for this surgery on this date. And I will say this, one of the things that they do ask you when they're pre-screening you before surgery is, are you aware of what you're having done today? It's really important they do that on the phone and then also the day of the surgery. I've heard horror stories, and there's actually medical malpractice cases where they've operated on the wrong side. So you were supposed to have surgery done on your left hand, they did it on the right. They were supposed to work on your right leg, they worked on the left leg. And so they do actually mark your body to make sure they're doing the correct side. And then they'll also ask you before you go in, what are you here for today? Could you imagine going in and instead of doing what they need to do on me, they do an appendectomy? I don't need to have my appendix taken out. So I would be really pissed if I went under and they actually did the wrong surgery on my body. And yeah, when that happens, usually people call medical malpractice attorneys. One of my friends works as a paralegal at the Kelly firm here in Hendersonville, Tennessee. And that's all they do is medical malpractice cases. He regularly appears on the news and, gives advice about those situations. So we don't want to reach that point. We want to go in, get all our ducks in a row ahead of time and not have any surprises on the back end. So wish me luck. My surgery is on Friday. And I'm actually just really excited to get the surgery done and over with and start healing. So positive vibes. I hope everybody has a great day. And again, if there was something in here that was helpful, or if you have additional tips, hey, nurses and doctors out there, if you have an additional tip, go ahead and put it in the comments. The goal here is just to educate, entertain, and help other people. So please, chime in and have a wonderful day.